Hello, and welcome to Medicaid Expansion, What Providers Need to Know. I'm Dr. Jennifer Lee, the Director of the Department of Medical Assistance Services, Virginia's Medicaid program. As an emergency physician, I know personally what it's like to be faced with obstacles in getting your patients what they need. I remember long, busy shifts in the ER, seeing countless patients who were having poor outcomes and in crisis because they couldn't get the access to care that they needed before it was too late. That is why I am really honored now to be able to lead the Commonwealth's Medicaid agency in a time of great transformation and positive change. We are providing coverage now for an additional 400,000 low-income Virginians who really need this care. Here at Virginia Medicaid, we are continuing to seek ways to evolve and improve the program to increase provider participation and enhance the provider experience in Medicaid. We want our new enrollees to experience improved health outcomes and greater opportunity for themselves and their families. But we can't do that alone. We need your help. Please join us in helping your patients sign up for coverage. Please consider taking more Medicaid patients if you currently are, or consider signing up to be a Medicaid provider if you aren't already. A robust provider network is more important than ever to Medicaid's success. We're grateful for your interest and participation in the Commonwealth's Medicaid program. Thank you.
Well, good evening. And Tony, thank you so much for the kind introduction. And it's great to be back in a hospital. I feel back at home. I really, what time do you all want to make some rounds here? Y'all are probably ready to go home, I suspect, a lot of you. But it is good to be here, and I just wanted to thank all of you for doing what you do and taking care of patients. And thanks to Bon Secours. I have a great relationship back in Hampton Roads. We have DePaul Hospital, which is there on Granby Avenue in Norfolk, and then Maryview, which is over in Portsmouth, and just provide wonderful care. As a matter of fact, both of my parents have been in DePaul, so we appreciate that. I was getting a little bit nervous when Tony was introducing me. She said I'm a former pediatric neurologist. I just want to let you know, in 3 years, I need a job. So hopefully I can.
We'll hire you.
All right. Hopefully I can continue to practice medicine. Wanted to recognize Dawn Adams. Dawn, thank you for being here tonight, one of our local delegates here. And before I just want to make a couple comments, because I know you all are here to learn about Medicaid expansion and who's eligible and what that encompasses. But I need to thank some folks. And first of all, people like you in this room that went around and talked to people, talked to your patients about the importance of health care and really how important it is for 400,000 working Virginians who didn't have health care before to now have it starting on January the 1. So all of you that were involved, I thank you. A lot of people, Tony, as you know, from the Hospital Association and just different advocacy groups across the Commonwealth reached out to people and I think helped educate folks as to the importance of this. And so I thank all of those folks. And then the last group I would mention, and Dawn is certainly one of this group, but it's the legislature. And this was not an easy vote for a lot of folks to take, but people really from both sides of the aisle came together. And for that, I credit individuals that work in Richmond. And as you might imagine, people come from different areas of the Commonwealth, different backgrounds, different agendas, and really for everybody to sit down together. It's what I call the Virginia way, and you may have heard me talk about that before, but it is that, it's okay to agree to disagree. That's a good thing. Discussion is a good thing, but at the end of the day, we really need to sit down at the table and put our differences aside and do what's in the best interest of our constituents, our fellow Virginians. And so a lot of credit goes to the House of Delegates and the Senate, and thank you for being here today. We really appreciate that. So thank you. It is interesting as we go around the Commonwealth of Virginia, and as a doctor, and I know as doctors and nurses and providers, you all are listeners as well. But here's what I hear from people. Here's what's important, and putting all the ads that you're seeing on TV now and all this attack things. But people want a job. In Virginia, they want a job that they can support themselves and their families with. They want to know that their children have access to a world-class education. And they want to know that they and their families have access to affordable and quality health care. And as I tell people, no individual in Virginia, no family should be one medical illness away from financial demise. And that's where people are when they have to stay at home in the morning and decide, can they go see a provider or do they need to put food on the table? So, Drew, I appreciate your reflection, and I truly believe that healthcare is a right. We are all, I'm not here to predict the future, but we're all going to have a day when we don't feel well and we need to go see a provider. So for people to have access to healthcare is just something that is very, very important, I'm sure, to all of us. So I appreciate all that you all have done. We look forward today, as you know, is the first day in which people can sign up. It's November 1st. Hope everybody had a good Halloween, by the way. And when individuals sign up now, they can be eligible for coverage on January 1st. And I want to commend, there's a lot of people that have been involved, but I see some people from DMAS here, and thank you all for all that you've done, and you've just done a wonderful job. And I think you've shown everybody that Virginia is a leader in this area. Last thing I want to just, they told me not to speak for more than an hour, so I will be brief here. But I did while I've got your ear. I just want to tell you, we've still got challenges in healthcare. And just very briefly, I look at healthcare as having three pillars that support the system. The first is quality. And I think we have great quality of healthcare in Virginia and this country. I mean, people come from all over the world, literally, to receive our medical care. Can you do better? Absolutely. But anyway, quality is one pillar. The second is access. And we've already addressed that a little bit, but everybody needs to go be able to see a provider, and certainly the expansion of healthcare will help in that regard. The third pillar is the one we continue to need to focus on, and that's the cost. And unless we work together and address the escalating cost of healthcare, and by the way, that's not unique to Medicaid. It's the cost of healthcare it covers all areas. And I really think that we as providers need to put our minds together, put our heads together, and figure out how we can get that under control. And just a couple brief concepts. One is that we're moving from fee for service to managed care. I think we'll see significant savings over the years. It's going to take a few years for that to happen, but certainly that's a step in the right direction. The second area is that we are moving from what I call a quantity-based system to an outcome or value-based system. In other words, when I was practicing, was still incentivized by how many patients I saw a day, how many patients I admitted to the hospital, how many EEGs, tests that I ordered, MRIs, etc. And so that's shifting, and it needs to shift to more of an outcome-based system. How healthy is the population that we take care of? And then the third area, this is food for thought while I'm here. An ounce of prevention is worth a pound of cure. And so many of our resources right now are going to treat diseases and disorders that we can prevent. Things like cardiovascular disease and things like type 2 diabetes and cancers that come from things like exposure to tobacco smoke. So I just mention those things because we still have work to do. And the expansion of healthcare, Medicaid expansion is a great step, a big step forward. But I ask you all to work with us as we move forward to address those three pillars. So I think probably my time is up, but I know Dr. Newhouse are here, and Dr. Lee, I believe, is going to be here if she's not already here, and are going to review kind of who's eligible and what that entails. So thank you all so much. Keep up the good work. And I will tell you, I have done a lot of things in my life, but taking care of patients and the reward that we receive when they do better and receive our care, I don't think there's anything and the greater calling. So keep up the good work, and remember, you're in the best profession in the world. So thank you all so much. Appreciate it.
So I would like to thank Governor Northam. I'm Kate Newhausen, the Chief Medical Officer of Virginia Medicaid and a family doctor. We were just delighted to have the governor join us tonight. Would also like to thank Tony and the Bon Secours leadership for hosting the event, and all of the provider associations, the Virginia Hospital and Healthcare Association that have co-sponsored. This is the 10th of 10 events we have held at hospitals throughout the Commonwealth. But you all are the only audience that gets the governor, so you should all feel very special. So I will be starting, and Dr. Jennifer Lee, who's an emergency physician, and my boss will be joining us soon. But I just wanted to share, I'm a family physician. I've served underserved communities, worked at the Hazy Willis Health Center in Southside Richmond, taking care of uninsured Medicaid patients. I'm a native Virginian, and this is, I think, the largest change to healthcare in our lifetimes. And I do want to echo the governor in thanking all of you for all of the work you do on the front lines, because it can be challenging to take care of our patient population. But I think it's also extremely rewarding, and you all are going to have the privilege of helping people who, many of whom you already served through the Caravan, through Bon Secours, but a whole group of people who will be getting health care, many of them for the first time in their lives coming in through expansion. So I'm going to share some of the basics with you all. I think the most important message we want to share is that the rules have changed for Medicaid expansion. Today, applications started. We were thrilled to hear that you already had patients applying, but coverage will start January 1st. And I think it's really important to note that many of your patients may have tried to apply back in 2014 when West Virginia and Kentucky expanded Medicaid and were told they weren't eligible. So really, you all are the frontline providers. Patients trust you as key experts on healthcare. So please encourage adults in your practices, parents of kids in your practices, to try again. So again, we anticipate up to 400,000 more low-income Virginia adults will enroll in no-cost health coverage. And it will be a lot of the working poor, people working in retail, construction, childcare, landscaping, food service, other jobs that don't offer health insurance, people who could be employees at Walmart. So this is the population that will be seeking care with a high burden of chronic disease, mental illness, addiction, and coverage doesn't mean access. We're really going to need all of you to ensure access. So this shows who qualifies for Medicaid now, or before November 1st, who our old eligibility. So you can see that this is children primarily. We cover children and families that earn up to 200% of the poverty level, pregnant women up to 200% of the poverty level, individuals with disability up to 80% of the poverty level, which is $9,700 a year. Parents in a family of three, this is was some of the most restrictive eligibility in the country. They could earn up to 33% of the poverty level, is about $6,900 for a family of three. And I had patients like this, and I have no idea how they survived on that amount of money annually. And then childless adults were not eligible. So even many doctors don't know this. My husband works at a Richmond area hospital, and he called me 6 months ago and said, Kate, I have this really poor patient. He's incarcerated now. He's about to leave prison, and he's really poor, and he needs Medicaid. And I said, well, is he disabled? And he said, no. And I said, okay, does he have dependent children? And he said, no. And I said, well, he can't qualify. And he said, but he's really poor. He has no money. And I said, it doesn't matter. In Virginia, it was not enough to be poor. You had to be one of these categories of poor. You had to be a very poor mom or a pregnant woman or disabled. So this is meant for providers like you, that people go to the Caravan, that pregnant women lose coverage 60 days after they deliver because they don't meet, the income threshold when it plummets. It means that kids who are 18 turn 19 and lose their coverage. It means that women who lose their kids to foster care because of addiction and want treatment can't get it because they lose their Medicaid coverage. So that is all going to change on January 1st. We will be able, and this eligibility rules took effect today, so people who are applying are being looked at under the new eligibility, and this is all online too. We have, there's a yellow slip in your folders that shows, that has a link to our website with the slide deck. So the new population is in green here. So we will be able to cover under Medicaid expansion individuals with a disability up to 138% of the poverty level, $16,750 a year. Parents up to 138% of the poverty level, $28,700 a year. and childless adults up to 138% of the poverty level. So essentially anyone who meets our age requirements, ages 19 to 64, not Medicare eligible, and our income requirements, and is a citizen or legal immigrant with 10 years of work history, they are all eligible. You all may have heard that we have two different pathways. The first pathway is state plan amendments, where we'll be implementing the new coverage January 1st for adults up to 138% of the poverty level. You all may have heard that there is an 1115 demonstration waiver that's on a separate track that has some new requirements like work or community engagement requirements, premiums, and some new supports like housing and employment supports for individuals with serious mental illness and substance use disorder. That is a parallel process. We are submitting it to the federal government tomorrow and will need to be negotiated over a series of months and then implemented over a longer time frame. So what's really important is when patients ask you, what about this work requirement? Do I need to have a job? Am I going to have to pay premiums? The answer is no, not on January 1st. None of that goes into effect. Just sign up and you don't need to worry about that. That is all coming much later and will only impact a portion of the population. So we do not want a chilling effect. We want you to tell people just sign up. None of that's in place yet, and there's many months of negotiations. This shows all of the different waiver changes. These were required under the bipartisan budget that passed with Medicaid expansion. So we've been directed to implement these as a Medicaid agency. We will be covering the new expansion population with the same 6 plans that cover our current population through the Commonwealth Coordinated Care Plus and the Medallion program. The 6 plans are here today. They're very excited to talk with you if you are interested in becoming credentialed as a Medicaid provider. They've come to all 10 of our events. And if you're in network with these 6 plans, which I believe Bon Secours is, then you don't need to do anything different. You will be in network for the whole expansion population too. We'll be covering all of the same services for our expansion population that we cover for our currently eligible: the doctor, hospital emergency room, maternity newborn care, community mental health, addiction and recovery treatment services that I'll talk more about, family planning. There is some enhanced preventive coverage, prevention and wellness services, annual wellness exams, immunizations, smoking cessation, and nutritional counseling. And I believe many of the plans will also be covering these for the currently eligible as well as the expansion population. So this should really help your patients who may not have gotten preventive screening ever to be able to actually access things like colonoscopies, mammograms. And then the health plans all provide robust case management and transportation. So the number one complaint I hear from providers is that a lot of their uninsured patients no-show because of transportation challenges. Well, the Medicaid benefit includes transportation to Medicaid-covered services when alternatives are not available. So all of the health plans can arrange that. How many of you have gotten information about Medicaid expansion, have patients who've gotten an envelope, have a family member? Has anyone gotten an envelope or heard or had a patient bring this in yet? Okay. Not yet. All right, we were at a federally qualified health center conference this morning, and a third of the audience had. One of the things that our team has really focused on is streamlining applications and fast track. So there are a couple of populations that are automatically going to go into Medicaid. The Governor's Access Plan, adults, those are individuals ages 21 to 64 with serious mental illness. They will automatically have full benefit Medicaid on January 1st. The Plan First population that gets family planning services and earns up to 138% of the poverty level, all of those individuals will automatically get Medicaid on January 1st. Then there are 2 populations that get the fast track application, and they're getting yellow envelopes, and they can answer just 3 questions instead of having to go through the full Medicaid application. So those are SNAP beneficiaries. Those are patients who might be getting food stamps. They'll get this special application, which they can return via mail. They can call our call center with the answers. They can go online. And parents of children enrolled in Medicaid. So anyone who's in a pediatrics practice, if the kids are in Medicaid, the parents are likely eligible and just need to answer 3 questions. Individuals who are in a qualified health plan, marketplace, who earn 100 to 138% of the poverty level can go online, open their application, and the marketplace will determine if they're Medicaid eligible and send the application to us. And then there are many different doorways for uninsured individuals to come in and do a full application. So Dr. Jennifer Lee has joined us, my my director, who is an emergency physician and a huge advocate. And she is actually an expert on the enrollment pathways, if you'd like to hand off, and has done a huge amount of work around this.
I'll just say a few words to them, actually. But you're doing a great job. You should keep going, so stay up here. But I'll just say, first of all, thank you so much for coming. I'm Jennifer Lee, the director of the Department of Medical Assistance Services, which is Virginia's Medicaid program. And we've had a busy day. You know, it's the first day of enrollment. And so I was actually back at the Ford with the team, just monitoring things. And we are on track to, we'll get all the numbers by later this evening, but we're on track to reach some record call volumes at our call center for enrollment. So it's great news. We know people, yeah. It's great news. We're excited that our outreach efforts are working. We know we need to keep them up because this is just the beginning. It's just the first day, but people really, really need this coverage, and that's what we're seeing even on the very first day. There's just flowing in, just piling in. I'll just say, let's see, one of the population that a lot of the calls we're getting today are coming from our streamlined groups, and so a whole bunch of mailings have gone out. And I think Dr. Newhausen was talking just a little bit ago about how we've come to understand the 400,000 who we believe are out there and need this coverage, and we want to get them into the program and covered. And the mailings that have gone out already are for our GAP program, those who currently they have a diagnosis of serious mental illness and they're getting some services, but now they'll be able to get comprehensive services. They'll be enrolled automatically into full Medicaid. So mailings have gone out saying, congratulations, you now will have full coverage. A card will come in the next month, in December, and then coverage to start in January. And Plan First, not for all of them, but for a large number of those in our Plan First program, which is another limited benefit program that offers only family planning services, they'll be able to get full services starting January 1st. Don't need to do anything for those who get the letter. And then we have some streamlined pathways. And so Dr. Newhausen was talking about those in the SNAP program and those parents of kids who have Medicaid who we know some information about, but we just need a little bit more information. And this is where actually a lot of calls were coming in today because we just pushed out the mailings to these groups. And you see some colors up here. We color-coded a lot of the mailings, but one of the keys, we did this because the mailing comes in a yellow envelope for those who are streamlined and in the Plan First as well. And so if folks are patients or members, clients out there, folks are seeing yellow envelopes, that does mean that they either might be in already and they don't have to do anything, or they need to just take some small steps to answer 3 more questions on a very simple application, and they can have full coverage as well. So those are a lot of the calls that we're getting today, and we just wanted to make sure that you were aware of those mailings that have gone out. And then there's everybody else that we really need to reach, and the people that we don't know, who you may know, you may work with, you may care for in your practices, in your clinics or organizations, and we really need your help to get the word out. And then, of course, we need your help to take care of them. This is just the beginning. So those are some of the pathways. I'll give the podium back over to Dr. Newhausen to continue on with some of the great innovations in the Medicaid program that really are helpful for providers, and be happy to answer some questions later on. But thank you again for coming.
So this just summarizes what Dr. Lee just shared with you and our team that has worked incredibly hard to get these fast-track pathways set up. So look for the yellow envelope, and these all need to be submitted by January 1st through our call center, the website, or mailed back. And they can always call Cover Virginia if they've lost these applications. So there are 5 different pathways to apply for Medicaid expansion. I've been asked by providers, what is the single best pathway or the one you recommend? I would tell my patients to call the Cover Virginia call center, and the number's right here, 1-855-242-8282, where we've staffed up. But individuals can also go to the online application at commonhelp.virginia.gov. They can go to the health insurance marketplace, especially if they're already there, at healthcare.gov. And for providers who participate with insurers in the health insurance marketplace, but not with Medicaid, we're really encouraging you, if you want to keep taking care of your patients, please consider enrolling with at least 2 of our plans, so you can keep seeing the patients that you care for now, because a large number of them will be transitioning to Medicaid. You can also go to your local social services office. You can mail or drop off a paper application or go in person to get help. And you can call the social services call center if you have patients that want to apply for SNAP or TANF, food stamps, welfare, or other benefits. So this shows our website, and this is probably the single best place to get information, coverva.org. This is where you can take patients to go see if they're eligible. All of this information is here in English and Spanish for the caravan. So there's brochures, there's posters. This is the single best repository of information, and you can also order bulk, and it can be mailed to you. There's also a poster and an FAQ in your folder. So we'd love for you to put that up in your office, weight rooms, doctor's lounges. And in your folder as well is our Medicaid Expansion Provider Toolkit, which our team worked very hard on. Lacey Heiberger in the back, my senior policy advisor, who arranged all of these 11 events and created this toolkit. This was really provider focused to answer the key information that providers have. And in this packet too, you've got the poster, the FAQs, the brochure, and here's a little yellow sheet where you can go to our website to get the most up-to-date information. You can also go to dmas.virginia.gov, and there's a little section under what's new of Medicaid expansion, what providers need to know, and you can click there and get the slides and get all kinds of information on the innovations that I'm going to share today. So I have spent 2.5 years in this role as Chief Medical Officer, and one of the things I really tried to do was listen to providers and hear, how can we make the Medicaid program better for you? Because one of our top goals is to really improve the provider experience and decrease the paperwork for providers and administrative burdens, so providers can spend time with patients and really focus on the meaningful face-to-face interactions. So the number one complaint I heard about in my initial days was our pharmacy prior authorization process. And I had providers telling me it is so overwhelming to have 6 different health plans and to have 6 different prior authorization paperwork. And I remember being in my family medicine clinic and finishing a day of seeing patients and then having a huge stack of paperwork and having drugs rejected because I'd put in the wrong paperwork. So we worked with all of the health plans through our CCC Plus program first and then Medallion 4 to implement the Common Core Formulary. What this is a list of preferred drugs on our DMAS preferred drug list that all of the Medicaid health plans must cover. It includes hundreds of drugs, 90 of the most common drug classes. So for example, we have 20 different hypertensive agents covered. We have a large number of oral hypoglycemic agents. So there's a whole variety of pretty much every chronic disease class is here, psychotropic medications, and the health plans are all required under contract to not require additional prior authorizations or added restrictions, and to also accept the DMAS fee-for-service prior authorization. So this was really designed to increase continuity of care for patients, decrease administrative burden for prescribers, and to ensure that we didn't have situations like when I wrote for an albuterol inhaler for a child with asthma, and a week later the child was in the ER, and I found out the health plan didn't cover albuterol, they covered Zopanex, and the pharmacy didn't tell me, and the kid didn't get their prescription and ended up in the ER. So this has been implemented in Central Virginia. You can go to our Virginia Medicaid Pharmacy Services website and download the preferred drug list or Common Core Formulary. Is an 8-page document organized by drug class, and what it means is if you write for those drugs, there's very limited clinical edits, like age for ADHD medications, and if you write for any of those drugs, they'll be covered by all of the health plans. And if they have a prior auth, which is based on clinical criteria, you can download our prior auth here and send it to any of the 6 plans. So the days of having to toggle between the different health plan websites and do all this faxing are over for the vast majority of the drugs we cover. And if you have issues with pharmacy, with medications, this will go into effect for December 1. It will be statewide. It will cover our entire expansion population. If there are any issues, email the Common Core Formulary email box because we want to know and we can help address any issues. And again, this is a reform that we've heard a lot of excitement about and worked really hard with the health plans and really hope it makes your lives better. The next reform I'm going to talk about is the Addiction and Recovery Treatment Services, or the ARTS program. Has anyone in the room heard of the ARTS program? Okay. Okay, so 5 people, okay. So this was an initiative that came out of the governor's task force, Governor McAuliffe's task force on heroin and prescription drug abuse. And one of the major recommendations was around Medicaid rates for addiction treatment. So based on our old rates, you could make more waiting tables than you could treating patients with addiction. So we worked with all of the managed care plans. We had a bipartisan package passed by the General Assembly and the governor in the budget to dramatically change our coverage of addiction treatment. And we were instructed to do 3 things. 1, broaden coverage of substance use disorder treatment to all of our patients with a substance use disorder instead of just pregnant women. 2, to increase rates to average commercial rates for addiction treatment. And 3, to redesign the entire continuum of care to create evidence-based services. Everything from, and these are all carved into managed care. We worked with a whole work group of providers and health plans to develop this evidence-based continuum based on the National American Society of Addiction Medicine. Everything from inpatient withdrawal management, residential treatment, opioid treatment programs or methadone clinics, office-based opioid treatment, peer recovery supports. And in our old world, before ARTS, 2 years ago, we actually, I don't know if you all had tried to refer patients for addiction, but my husband actually had a patient at a local hospital who was injecting 3 bags of heroin a day, and he was a Medicaid member. And he said that he was hospitalized with a different complaint and said, "Doc, I really want to quit. I want to stop using. I want, Suboxone." So my husband started him on Suboxone and then turned to me and said, "He's a Medicaid patient. Where can he get outpatient treatment?" And I called the local community service board. It was a 6 to 12 month wait for a Medicaid patient to get addiction treatment in the Richmond area. So my husband, we finally found one doctor who didn't take Medicaid and would accept $100 cash per visit for this patient to get treatment. So my husband said, "I'm really sorry. I know you can't afford that. I know you can't get treatment despite wanting this evidence-based treatment, medication-assisted treatment." And his patient said, "No problem, doc. Discharge me tonight. I will sell heroin on the streets tomorrow, and I will get enough cash to go pay for my Suboxone." And that was the situation in Richmond, that we had Medicaid patients selling drugs to pay for their treatment. And can you imagine people selling heroin to pay for insulin? So that world has now changed. This shows you the providers before ARTS. Again, we had 2 methadone clinics actually billing Medicaid for treatment. So we literally had pregnant women with Medicaid coverage paying $100 a week cash who were in danger of losing their home because they couldn't pay their mortgage. Now we have 39 methadone clinics, including several here in Richmond. We have residential treatment, 94 providers. We have 136 intensive outpatient programs. We just hit 100 of these preferred office-based opioid treatment providers, which are centers of excellence with co-located buprenorphine-waivered practitioners and licensed behavioral health clinicians, providing the gold standard medication-assisted treatment, which is buprenorphine, counseling, care coordination, that we know results in a 50% recovery rate from opioid use disorder compared to 10% with abstinence alone. And we actually have some really phenomenal clinics in Richmond. Daily Planet, Beth Merchant is here, the director, has an incredible program that has 90 patients that has literally saved people's lives. VCU has a remarkable clinic, Motivate. We have seen health systems around the Commonwealth create these programs, Carillion, UVA, ANOVA, and have just seen a phenomenal interest because we created a much higher reimbursement rate to support the model so you can actually pay for the licensed behavioral health clinician on site providing the highest quality care. This map shows all of our ARTS providers. You can go to our website. We do anticipate that the expansion population will have significant needs for treatment, so this shows how you can go find preferred OBOTs and encourage you all to think about whether you can offer addiction in your practice and or refer to our high-quality ARTS providers. Here are the maps. So we worked with the Department of Health, and you can enter a patient's address and find all the ARTS providers located nearby. So the final innovation I want to talk about is emergency department care coordination. Has anyone heard of this? Does anyone work in the Bon Secours ER? Okay, so this is a single statewide technology solution that was implemented by the Virginia Department of Health. It's a real game changer. It connects all hospital emergency departments in Virginia, enabling integration of real-time alerts directly into the hospital EHR. So it means that providers and clinical and care management staff are receiving alerts with hospital admissions, discharge and transfers, care coordination plans, advanced healthcare directive registries are embedded in the system, and we're working on prescription monitoring program data. On June 30th, this went live across all the emergency departments in Virginia and all 6 of our managed care plans. One of our plans shared that they got a real-time alert of a 19-year-old woman who was suicidal and was in the ER and was able to send a care coordinator to her bedside to get her into a psychiatrist. So we're already hearing stories. You can actually get a real-time alert and see 2 years of ER and hospitalization data from any Virginia hospital, any West Virginia hospital. Starting this winter, we'll be onboarding primary care providers, community service boards, federally qualified health centers. And Medicaid providers are prioritized for access to the system. So Bon Secours has implemented this in the ER, and now there's an opportunity to implement it for downstream practices too. So these are just 3 innovations we've worked hard to implement over 2 years. We're really eager for more ideas, more suggestions. So if you have ways that we can improve the program, improve patient outcomes, improve the provider experience, please share them. Myself, Dr. Lee, and our leadership team are really eager to hear from frontline providers about what you need to make the program work even better than it already does. So again, to summarize, we have up to 400,000 Virginians who may qualify for coverage, but coverage doesn't mean access. We need all of you. We have implemented these new reforms such as Common Core Formulary to decrease the administrative burden for providers. I actually had a provider tell me that Medicaid is now easier to deal with than commercial insurance for prescriptions, which is exactly what we want to hear. We have new statewide resources to increase collaboration, address the needs of complex patients, like our Addiction and Recovery Treatment Services or ARTS program and Emergency Department Care Coordination. So if you're already accepting Medicaid patients, which Bon Secours is, and I know there may be some community providers in the room, please consider opening your panel to more Medicaid patients. Please help us educate your patients that the rules have changed and encourage them to apply for coverage. And consider becoming a provider champion and presenting on Medicaid expansion in your community because you all are really trusted leaders. And if you are here as a community provider and you're not taking Medicaid now but are interested in accepting Medicaid, you can enroll as a DMAS fee-for-service provider at this website here. And you can also pick 2 or more health plans and join their networks. And all the health plans are here today because they would love for you to join their networks. So we also have all the information. This is also in your provider toolkit of how to reach out to the health plans to become a credentialed provider. And if there's one thing you do today, I would encourage you all to go to the coverva.org website. And you can enter your email address. It takes 10 seconds. You can do it now and sign up and get all the latest news and updates. There's also an option to enter your cell phone and you can get text messages. So, I got the text message today that application's being accepted, and it's a great way to stay up to breast of all the most recent information.